Recording.
All right, good morning, everyone. Welcome to the monthly hybrid meeting of the Southside Wellness Coalition. People are still rolling in from the waiting room, but we'll keep rolling. Did you go in there yet? I can tag you, let people in. All right, let's see. So we'll go ahead and start with our agenda, and then we'll go back with introductions. Again, everybody in the room has an agenda as well as a copy of the minutes from last month. We also brought you a pen. We also brought you a new back of the phone lock and talk, um, whatever that fancy thing is you put on the back of your phone with all your credit cards, snacks and drinks. Those of you online, welcome to come join us in person anytime you'd like. Here we have the agenda on the screen for everybody. There we go. Awesome, awesome. I want to be able to scroll down that. Here we go. Come on. There we go. Put you all over here. There it is. All right, March 19th. I'm going to be doing approval of minutes, going over Introduction to Gaming and Gambling 101 by the prevention team, talking about the young adult outreach, update from our two youth coalitions, updates from the mental health summit for our local service members, veterans, and their families for May 21st, updates from the infant maternal health collaboration, and then updates on the book club at Halifax, and then any other updates from leadership and members. I'm sure imagine lots of great information to share today, lots of flyers, lots of great information as well in our newsletter that came out on Tuesday. All right, we're going to stop share on that. And what we'll do is start in the room with introductions. And if everybody again in the room and online would be nice and loud for our lovely owl companion, so we get everything well documented. So I'm Kenan Tyner-Smith, the fiscal agent for the coalition, and I'll popcorn it to Elena.
Hey, I'm Sherry Martin, Healthy Case Manager at Tyner-Smith and co-chair of the coalition.
Brenna Lake, Population Health Manager for Sandy Danville and Southside Health Partners.
I'm Danielle Lucas with Tri-County Community Action Agency. I help lead the coalition of infant and maternal health and infant maternal health home visiting service.
I'm Jenna Dahl, a prevention specialist here at Southside Behavioral Health. And I'll popcorn it to Teresa.
Right.
Good morning. I'm Teresa Slaybaugh, the lead healthcare instructor for the Healthcare Training Hub here at the Southern Virginia Higher Education Center. And Brittany?
My name's Brittany Roller. I am a healthcare instructor here at the Southern Virginia Higher Education Center. Popcorn to Kevin.
Kevin, you're muted.
Oh yeah, there you go. Great morning, everyone. Kevin White, Deputy Kevin White with Mecklenburg County Sheriff's Office, and part of the leadership team. And I'll popcorn it to Miss Grimes.
Good morning, everyone. I'm Jeanette Grimes, community health worker with VDH and part of the coalition's leadership team. I'll popcorn it to Mr. Holzendorf.
Thank you, Ms. Grimes. David Holzendorf, principal at Mecklenburg County High School, part of the leadership team, and I can't remember who's had popcorn yet, but I'm going to send it to Teresa. You ready to go? Oh, I'm sorry. Mary Beth.
Hey, I'm Mary Beth. I work at the South Boston Public Defender's Office. I'm the mitigation specialist here. And I will popcorn it to Destiny.
Hey, I'm Destiny. I am the maternal child health community health worker with the Department of Health for the Southside District, and I will send it to Khadijah.
Hello, my name is Kadisha McCarville. I'm the coordinator for the Mentor Role Model Program at Tri-County Community Action Agency, and I'll popcorn it to Elizabeth.
Morning, I'm Elizabeth Bordelon with Tri-County Community Action Agency. I am the intake specialist, and I will popcorn it to Kimberly Gordon. I can pick somebody different if Kimberly's not there. I'm not quite sure who all has gone. Amy Trent, have you gone yet?
No. Hi, I'm Amy Trent. I'm with Virginia Legal Aid Society. Thank you.
How about Shannon Simpson?
Yeah, I'm Shannon Simpson. I'm with the COPE Project for Virginia Tech. And who all? I'm looking to see if anybody's been missed. Dennis. Or Brian.
Good morning, Brian Price with the Virginia Rural Health Association. Kenan, who's
Awesome.
that?
Yes, we have Allison Byrne.
Hey everybody, I'm Alice Byrne. I'm the Community Engagement and Partnership Coordinator with the Central Virginia VA Medical Center. And I'm not sure who's left to go.
Great. We got Kimberly Gordon has introduced herself in the chat box. She's from Halifax High School. Also leader of the TARP. Dennis is here. Dennis is local SMVF veteran in our area. And I am checking my dynamic screen here, which is, I don't think we missed anybody. Awesome. Awesome. Well, wonderful, wonderful. Welcome y'all this morning. So glad so many folks could join us this morning. So we'll go ahead and bring up our minutes from the last meeting. All right, here we go. And again, those of you in the room, you have a copy on your desk along with a pen. All right, so on the screen, you'll see the share. All right, last meeting was on February the 19th. Oh, I got the wrong date on that. I got 2025. What am I thinking? Is this the right set of minutes? I shouldn't laugh, but I'm like, uh-oh, is this the right set of minutes? No, it's wild how we look at these for days, and it's not until you get them on the screen when you pick up on it. Presentation, yes, it was me. Adverse childhood experiences, good. All right, I just want to make sure it wasn't actually February from 25. All right, speak updates, TARP updates. Awesome. All right, well, only thing that needs to be changed is a date possibly, but again, the floor is open for any questions, concerns, anything about the minutes from last month other than the year. Okay.
Looks good to me. I will move to approve.
All right, Elena makes the motion to approve. Can we have a second? All right. Brenna has second. Thank you all. So minutes are approved and will be posted. And I guess that's something too we need to mention. We are in the process of working with the company that manages our website as we get 2 more people coming in the waiting room. Updating and making our website more user-friendly, moving things around. So the location of recorded meetings is going to be shifted. So it's not so busy. So just be aware when you start getting the newsletter that we'll have some updates in there about we're trying to make the website more user-friendly. So folks are wanting to find the meeting. It's going to become easier to not do so many clicks to get to that. But that'll be featured in our newsletter in the next couple of months. Just some behind the scenes work. We're trying to make sure that folks are getting good information from the website. All right, then we'll go back to the agenda for today. All right, which hopefully I put the right date on. Oh, I did. Good. All right, let's see. Meeting minutes. Here we go. What?
Your name isn't on there. The Fiscal agent.
Oh, that's all right. That's all right. All right.
Well, we don't review this.
All right, agenda. All right, so approval of minutes and then a presentation. Again, want to start getting you all connected to the gaming and gambling information we're sharing in the community. And then we're going to move into talking about the young adult survey outreach. Again, talking about our youth coalitions, how they're working, how they're doing. Again, talking about the summit coming up in May 21st for local veterans and their families, an active service member. Talking about the infant maternal collaboration, updates from the book club, and then any other, again, updates and information you want to share. I know I've got a number of flyers that are inside my little folder here online. Okay, awesome. And then, of course, as usual, you know that Jenna's going to follow back up with everybody with that follow-up email that includes all the information plus any handouts and such from the meeting. You know, she does the aftercare with everybody on the call. All right, with that being said, we will move to the presentation. Okay, gotta make sure. Here we go. Altice just arrived. She put in the chat box there. Okay, then we'll go to the presentation. All right. Awesome. Let me move them out of the way. I tell you can't whisper, can you, on this thing? Wait a minute. Take the timers off. Here we go. Awesome. All right. So to preface this before we start, as you guys are all fully aware that they are building casinos across the state of Virginia. And of course, we have one here close in our neighbor in Danville. And in recent months, we've been receiving funding to create brochures and handouts and co-sponsor events with Danville, Pennsylvania CSB and coordinate various activities around educating people around gaming and gambling, about the basic information, and then problem gambling, and then also developing a youth curriculum where we could go into various youth serving organizations and provide information to youth. As part of that outreach, we are now hosting today's introduction, and then also in the newsletter on March 26th, we're hosting an evening virtual training that's open to the community that we're publicizing, again, that shares the same core quality information. So this is going to become a part of our outreach as prevention department. And Jenna, you're going to start for us.
And March is also Problem Gambling Awareness Month.
That's right. That's right.
FYI. So we're going to do an introduction to gaming and gambling by me and Kenan. And these are just, that's the logo for the Southern Virginia Problem Gambling Collaborative. This is just a little disclaimer that it's going to talk about gambling, substance use, suicide, and things like that. So these are the things that we're going to go over. We're going to go over the definition of gambling, the different types of gambling, the history of gambling, and then what's problem behavior versus social gambling, the signs and symptoms of problem gambling, co-occurring problems, risk and protective factors for problem gambling, signs of youth and youth gaming and gambling, and then the needs of those things, and then how to focus on some services, and then the resources. So quick question, which of the following is gambling? Is it bingo, buying raffle tickets to support high school football team / a marching band, playing in a casino, buying scratch off lottery tickets, playing slots, Friday night poker games, participating in NCAA tournament bracket competition, or using chance-based apps that require money?
All of the above.
Thank you. Yes. You guys are correct. It is absolutely all of the above. So the gambling definition is betting money or something of value on an event where the outcome is determined in part or completely by chance. And these are some different types of gambling. So there's chance-based, which is the results are random. This is like roulette, lotteries, bingo. And then there's also skill-based. It's your ability or skill can somewhat influence the outcome. And this is going to be more like card games or, horse racing. You can understand like, the stats of the horse, those kinds of things. And also sports betting, again, knowing the stats of your players and things like that. But there's still a risk in the outcome. There's never a sure answer to what you're betting on. So these are just different forms of gambling. Bingo, like we already said, raffles, slots, poker, blackjack, sports betting, horse betting, lottery, electronic gaming machines. And there's also like a bunch of online casinos too, but those are not legal. All right, Kenan, I'm gonna let you do the history.
Oh, yeah. So, of course, we know through the state of Virginia, charitable gambling started in 1973. The Virginia Lottery was available starting in 1987, and horse racing and Lansdowne. In-person tickets started in 2018. The laws began to change around the gambling, what could be done in the state of Virginia, as you can see, starting in 2019. And then, of course, there's been a growing interest in online gaming and also putting more brick and mortar casinos and Rosies across the state. And you can see there that we're just building momentum across the area. Danville's now fully opened, and Petersburg is scheduled to open in January. So it has been a part of our community for years. We just want to make sure that if folks are developing problems with their use of gambling, that they get connected to services. So there's there's a whole spectrum of what can be done in terms of gambling behavior for both young people and adults. Non-gambling, obviously those that don't gamble. Social gambling is just generally doing some fun with friends and family. Responsible gambling, obviously being a part of understanding how much you're going to use, monitoring what types of money comes in and out and where. Problem gambling, of course, like any other situation, it's impacting my life, right? Impacting the quality of my life in a negative way, and then developing a disorder where, again, it takes over. So social gambling, again, engaging in gambling behavior with the intent for fun or socialization. Players are competing on equal terms. And again, this would be something that would happen in a social setting. Wouldn't be something that you would be doing necessarily on a daily basis. Responsible gambling, of course, means that you're able to exercise control over your activity, right? And again, it's not negatively impacting your life. You decide, well, I'm going to travel to the local Rosie's or the casino, and I'm going to spend maybe $25 out of my check. But that $25 may be also what I would have done for spending to go out to eat or going and doing any other fun activity like fishing, or what else do we do for fun? Movies. Exactly. So lots of different fun activities. And of course, I use my money to go to the local casino. Problem gambling, of course, again, by definition, means behavior that's disrupting any major area of your life. Again, spending time doing this activity is impacting the quality of your relationships, maybe impacting your ability to do well at work, maybe impacting your financial situation in terms of being able to pay your bills, and again, utilize funds to support the different folks and your ability to do well. Certainly in terms of responsible versus problem gambling, again, responsible gambling, this is how it presents, right? This is how it presents with folks around you. Because keep in mind that one thing that we want to share about gambling, problem gambling, is that it's not something you can smell on folks. It's not going to be something that comes in pill form. It's not going to be something that is going to be smoked, right? That problem gambling really can come down to simply doing it on a phone, right? So you could be in a room with someone who is gambling. So this, again, we want to pay attention. We're just asking you as local folks to raise your awareness like you do around any other responsible or problem that's developing for a young person or an adult in your life that you care about. So again, what would it look like if I'm a responsible gambler? I'm going to stick to limits. Obviously, obviously everyone has the hope to win. I would have the hope to win with whatever I'm playing at the casino. I can take it or leave it. It's not going to overwhelm me. If I lose my $25 here, it's not going to be something I can't manage I avoid bets again, avoid bets that are more than they have, right? So you're not going to see Kenan with her responsible gambling going up to the table with $1,000. Again, knowing what you would know about me, that's probably not going to be a good amount of money for me to be having fun with. Right. I mean, you think about, again, people you care about in your life, right? What are you looking for, right? I'm a focus on fun, socializing, right? Elaine and I bumping elbows. It's all going to be about that's responsible, right? That's having good time, smiling. It's occasional, right? So how many times again do you see me? You care about me. I'm one of your loved ones. How often do you see me going to the casino? Again, responsible gambling, that's going to be occasionally, right? The times we have fun away from family and friends or with family and friends for like special occasions, celebrations. And again, final one again, plays with family or friends. Watching me again, being aware if I am developing problem gambling, I'm going to continue to play even when large sums are lost. So again, you're going to hear me verbally talk about that. You might sense that. Again, if you're close to me and know about my financial situation, you would know that from statements. Again, family, friends would pick that up. Chasing the rush, like I've got to worry about getting back to that casino, worrying about to get that particular slot machine. Playing to win back losses. Again, this is spending more of my time and effort and money, convinced that I'm going to get back what I've lost. Plays with borrowed or needed money again. So I'm approaching friends and family, asking for cash, asking for loans, again, and you realize I'm going to the local casino. Again, I'm focused on gambling and winning, talking about making bets, frequent or inconsistent, frequent or consistent, again, trips to casinos, or again, you notice on my phone, I'm doing that as well. Playing online with strangers or playing alone, right? This is where it's most likely I'm developing a problem. Again, I'm isolating myself. Again, this comes back to awareness with other kinds of concerns around other substances as well, right? Using with strangers or alone.
Just like any addiction,
Oops.
if gambling is affecting your quality of life,
Mhm.
then it's a problem. Secrecy is another big one as well. Spending outside of your means, things like that, like Kenan said.
Yep. And then we have by definitions, the gambling disorder, persistent and recurrent problem gambling behavior leading to clinically significant impairment. Obviously, we're not suggesting that you're going to be diagnosing anyone, just like any other behavioral health. We want you to refer folks to professional services, right? Oh, and Jenna's coming back in. I forgot.
No, I just want to give a fun fact.
The tag team in here.
Gaming and gambling disorder is the only physical addiction in the DSM-5. So all other substance use disorders are actually from a substance. This is the only one that's a physical disorder in the DSM-5, which is pretty interesting. Here's some signs of gaming and of gambling addiction. Just kind of like we just talked about, social withdrawal. So you're choosing to gamble instead of connect with other people. It's a financial burden on you. So you are borrowing from other people or you've spent outside of your means. Emotional, like we know with any other kind of mental health issue, if there are hygiene or mental health distress, and you can see that on somebody, and such as their mood or their appearance. Also, like I said earlier, if they are being secretive, they're not doing the things that they usually would do, they're lying about it, they're stealing. And then also having, because of our phones, having them constantly on us, there is gambling constantly at your fingertips. So if someone is spending a long time on these online casinos or sports betting, those kinds of things, it could possibly be an obsession. Problem gambling often co-occurs with a lot of different mental health problems such as anxiety, depression, suicidality, substance use disorder, like we already talked about, problems in the family, also low socioeconomic backgrounds. We know that casinos kind of do pick places that have low socioeconomic areas. There's also family violence, antisocial behaviors, criminal behavior, incarceration. And then also economic problems, poverty, unemployment, homelessness, and then social problems such as relationship difficulties. Some of these economic problems are because there is notion that gambling is a way to earn money, but that is a myth. Because of the risk involved, there is no guarantee that you will actually create the fortune that you see other people doing, right? That is just pure luck. So, and then 70%, 75% of those diagnosed with the gambling disorder also have a co-occurring alcohol use disorder. And 40% have a co-occurring drug use disorder. So that's just the substance use with the gambling, which makes kind of some sense. So, why do people gamble? They're having challenges, coping with some stress, escapism. It's fun. Excitement kind of brings them in. Also, like I said before, the possibility of bringing some income in. Some people feel like they do have control and mastery. You know, some people wear like their lucky socks and things like that. Um, um, Also, when you win big amounts of money, usually you get recognized, and also casino will also sometimes reward you, things like that, right? You can get hotels, you can get vouchers, you can get all those kinds of things. And also, there's plenty of people at casinos all the time, so it is a way to build relationships. Risk factors for problem gambling are the ones we pretty much just mentioned: stress, sensation seeking. That's pretty much just looking for those feel-good things in your brain. Sometimes gambling can cause that, and then can lead to problem gambling. Normalization by media, we've seen a rise in not only casinos being advertised, but also sports betting. You can also see a lot of the online games, not the illegal ones, but the ones where you can spend money and have a better chance of winning. And we also see celebrities putting those on as well.
Yeah, a lot of celebrities these days.
Yeah, like Kevin Hart and those kind of people. Like I said before, mistaken beliefs about the odds of winning. They feel like it's purely skill. Not true. There's always risk involved. Mental health diagnosis, like we already talked about, impulsivity, hearing about parents or other family members gambling, again, history in the family. Doing it very early, cultural acceptance. We know that gambling is pretty normalized in America. An early big win is a big one of that as well. So you get that rush and see that big sum of money come in, you are more likely to chase that for the rest of the time that you're gambling. Access to opportunities and also ACEs, which you guys had a presentation on last time. So what is an ACE? You guys know this. It's an adverse childhood experience that can have negative and lasting effects on a person's health and well-being. It's literally just the fact that before the age of 18, if trauma happens to a child, it reroutes their brain, and therefore they have to deal with whatever it is that they're dealing with. And that's usually an explanation to why people behave the way that they do. So to talk a little bit about youth problem gambling, it's a growing concern. These are just some stats. We believe that the risk for problem gambling addiction overall has grown 30% from 2018 to 2021. It's an increase in criminal behavior, dropout rates, and a decrease in academic performance. So it's really affecting young people and their ability to function in society. And the internet and online gambling obviously possess new risks for youth because, again, gambling is at your fingertips all the time. Some protective factors for youth problem gambling are strong bonds with school and community, parent supervision and involvement, positive childhood experiences, positive parenting, financial security, and destigmatization, which again, if you remember from our ACEs, very similar stuff here, right? You have competent care, you are more likely to not have as many risks for problems, which also includes gambling. What types of gambling are youth engaging in? A lot of it is online. So we've got video games and apps. Betting on school sports is also one. Truth or Dare, internet challenges, fantasy sports, trading card games, lottery tickets. We know that that's a pretty big one, especially for, I know that they're not technically youth, but 18-year-olds. That's like a big thing around here is buying your first lottery ticket for your 18-year-old birthday. And I'm gonna be honest, I still think 18-year-olds are pretty much youth. I know technically they're not, but like they're still under the age of 25. Their brain is still fully developing. So it does make a difference. Dice games, so we've got card games. Families sometimes play card games as well. And loot boxes are a big one. That's for a lot of those like online games that people are playing. Why do we want to focus on youth? To increase, they have an increased risk to develop problem gambling, 2 to 7% of youth. 10 to 14% are at risk of developing an addiction. And 60 to 80% of high school students report have gambled for money in the past year, which is a pretty big percentage. And again, if we go back to the risk factors, starting early on puts you at a worse position to have a problem later on. Youth calling problem gambling hotlines has doubled from 2018 to 2021, which kind of matches the numbers that we saw increasing in the previous slide. Gambling addiction and substance-related addiction looks almost identical on a neurological level. So what that means is that we have seen brain scans of people who are gambling, and when they've won, it has the same effect as being on like cocaine, as using a substance. But also the interesting thing too is it's not just when you win, it is the chance of winning. So when you're sitting there waiting for that skill game or or you're scratching off the lottery ticket and you're sitting there waiting to see whether or not you've won or not, also the same response. So then when you find out you won, then you continue that response, or you lost and then you chase it again, right? It becomes this cycle.
That makes sense though. Dopamine isn't necessarily the pleasure chemical,
Mhm.
it's the anticipation of pleasure chemical.
Right, right, exactly. Alrighty, youth with gambling problems are more likely to drink heavy. So again, with that substance use co-occurrence, we saw that that's really high. Drive under the influence, again, co-occurrence. Engaging in risky sexual behaviors have lower academic performance, like we saw earlier. They're dropping out, they're not staying in school. Use illegal substances, again, co-occurrence. And then use tobacco or nicotine problem. Most of this is co-occurrence with other substances. What can we do? We can educate ourselves. We can understand how gambling works, explain that it is all up to chance. There is no strategic gambling. Keep up to date on what's going on around you in terms of like, what are your children using? What are the high schoolers doing? Talk about screen use and online gambling, again, because it's at your fingertips. Think about family attitudes and activities. Sometimes, be careful playing like card games and things like that, especially for money early on, right? Because we just know that the earlier onset that people are exposed to addictive behaviors, they are more likely to have an addiction later on. That's all. Be a positive role model. We know that connection is really important for youth and also other people. So that just goes back to that. And encourage support always. And you can also volunteer to help out with the Southern Virginia Problem Gambling Collaborative. Are there any questions?
You may not know the answer to this, but
Okay.
I have an 18-year-old. I definitely agree with you about when youth doesn't end. But have there been any initiatives about changing the age to buy lottery tickets the way we up tobacco?
Yeah.
That's a great idea. I don't know.
Not that I'm aware of, no.
They turn 18, they go right to it.
Right,
They
right,
get a
right.
$50 bill, they win $1,500.
Right. Which is strategic
I
too
think
by
what
the
the
casino.
legislative body has been grappling with in recent years is just the proliferation and decisions around, how many who
Also
get-
skill games too, which we haven't really fully tackled that either because they are illegal, but they are on and being used in Virginia.
Right.
So
Just like there are illegal products in the convenience stores around.
Right.
Various.
The vapes and stuff.
Right.
Right.
Even though they
Right.
have changed last year. Right. Right. So I think they're grappling with more about just the growth. And then again, I think what the state is doing through CSB is developing curriculum like this.
Right.
Because more parents know, the more local adults know, folks working in the various youth serving systems know this information and can go home with it.
Right.
And change their perception and reality about how they deal with, like you said, playing games, like board games with your kids, but not introducing money into it. And then of course we have access now to a youth curriculum.
Yeah.
Which again, state has certain guidelines around it, but we can go into youth serving organizations and get in front of youth and do activities with them.
Right.
Again, around responsible gambling.
We also, I know you guys, we've talked about counter tools with us before about how we have to go to all the tobacco retailers and assess them and then give them information about not selling to youth. We actually do the same thing through the Southern Virginia Problem Gambling. We do it with all of the people that sell lottery and have skill games and things like that. So we are visiting, assessing all of the retailers and also giving information about not selling to those under 18. But again, they're just assessments. Can't do like
Not inspecting them. We
Yeah.
only can educate them around what they have in terms of the Virginia lottery, what they've got in the room.
So another question, and again, y'all may not know the answer to this. I don't play the lottery, so I'm not very familiar, but I know they have those machines where you can buy tickets. Do you have to show your ID for that?
Not in Virginia.
So
Nope.
like, a 15-year-old could go in there.
In theory, yes. Yep. In North Carolina, you have to scan your ID, but in Virginia, no.
Again, maybe that's something we should consider.
Yeah.
Do not have enough to do.
Environmental change, absolutely.
Any other questions on Zoom? Not, I'm gonna keep trucking.
I like this.
Not so much a question, but I added a little comment in the chat just about the SMVF population and specifically service members. We see problem gambling a lot among service members, and so thinking we're talking about youth, like a lot of times people are joining when they're 18, and just also the proliferation of those skill games. Like I know when I go into VFWs and things like that, a lot of times they have those there. So just a little bit of data that I dropped in the chat if anybody's interested.
Thank you. Yes, and then at the SMVF mental health summit that we're doing, they are going to cover problem gambling and also about service members, veterans, and their families too.
Yes,
But
that's
thank
right. Our presentation we have scheduled after lunch. We'll share this information.
I actually think the one that you guys are doing, the other on, what is it, March 24th? I think you guys are
March
talking about that.
26th. Yeah.
March 26th.
Yeah.
I think you might be talking about it then.
Next Thursday night, yes.
Yeah.
So Allison said service members experience gambling addiction at twice the rate of the civilian population. Estimated 40% of veterans and service members who seek treatment for gambling addiction report having attempted suicide. Shannon says my son shared that some of his friends at UVA are having problem with online sports betting. Yeah, I know the other day, and when I taught a class in South Boston, I had some younger folks in the class in their 20s. And during the break, a young gentleman and I were just chatting, and he was on his phone. And I said something like, "Oh, you're checking your Facebook or whatever, Instagram." And he said, "No, I'm placing my bets." And I'll tell you, my mouth dropped open just at that sort of nonchalant response he said. And then, of course, I went into that perspective of sort of chatted with him a little bit, talked about, and then he shared some details. So
Part of
Well,
my
you know,
job
and I was going to say, you've also got to remember that there is that there's a large component of this, even in stock trading. That you'll see that people they look at stock trading, and it's basically the same thing. It's also online gambling that they think has a skill component.
So for part of my job, I have to help people work on their budget and form a budget that they can stick to. And so with the training I went to for that, they asked us, they asked a bunch of different demographics how they would save $1,000 in a hurry. And for the demographic that the income of under $20,000, like 9% said lottery. That's how they would come up with $1,000. So I think that plus the military situation, I think a lot of it is cultural.
Okay. Any other comments, questions? All right. I love that slide, by the way.
This is just a disclaimer. The Southern Virginia Problem Gambling Collaborative is providing this information to educate adults, and they do not specialize in treatment of problem gambling. If you know someone who's struggling with a gambling problem, please contact one of the appropriate resources, which I'm going to share in just a second. This is how you can follow the Southern Virginia Problem Gambling Collaborative. We have Facebook, and then also there's a website. And the Southern Virginia Problem Gambling Collaborative is us, Danville, and Piedmont. So we work all together on putting on a summit. We do tablings, those kinds of things. Speaking of which, we have a summit coming up on June 17th. It's going to be all day. It's going to be at the Institute for Advanced Learning. Registration is open, so you guys can register at any time by using the QR code, or you can contact me and Kenan. We can send you some information too.
It's of no cost, and there is lunch.
Yep.
Lots of good information.
Yeah, there'll be a lot of good speakers that day too.
I
Alrighty.
don't know what happened to our names.
Okay, well, there they are.
Oh, okay. I was like, darn. Don't do that. Don't do the survey.
Don't do the QR code. Sorry. Sorry.
Really busy this week.
Yeah, don't worry about the survey. You could just verbally tell us that we did a good job. Thank you. Yeah. Appreciate it. That's good enough for me. I like praise. Just kidding. Yeah. We can do that.
Fancy stuff sometimes throws me.
Oh, I know. And then here's just some resources. Always 988 Virginia Problem Gambling Helpline. And then you can also call 1-800-GAMBLER as well. And I believe that's it.
And of course, as you said earlier, if you all would like to have, we have brochures, handouts, good quality information. We've had professionally printed. So just like any of the other resources that you all get from us, we have resources connected to problem gambling and information about it. So again, we wanted to present this today, have it available to you all now that you know. And then if you want to incorporate that as part of the information you share with the community, we have all the different accoutrements that go along with this.
Yeah.
And like I said, we also have a youth curriculum that we've been trained in that we also can do, just like many of our other trainings. And when we update our training flyer, most likely toward the end of this year, as we run out of those copies, we're going to be adding to that our youth problem gambling curriculum to that. Just like we're having Safe Talk, Assist, and Mental Health First Aid, this is going to become part of that.
Right.
So looking forward to doing more educational stuff.
All right.
Okay, cool. All right.
References. I'm done.
All right. So, all right. Next on the agenda is young adult survey outreach. I can do that real quick. So just so you all know, I'm sure you've seen on our social media that we launched February 2nd and rolling till April 30th. My team and I are out getting in front of all the young people across the state of, the young people in Southside, Virginia that are 18 to 25, asking them to complete a survey. Great news is that we are first place. We have never been first place. I'm so super excited. We have, as of 3 days ago, 394 young people in that age bracket have completed our survey. So our team has been, everywhere. We've been in bars and breweries and gyms, and we've gone to SVHEC. We're going to South Hills Advanced Knowledge Center. If there's a young person that travels to a particular business or particular area, we're trying to intercept them. We also were able to get into the Meherrin River Regional Jail, and those young people who are unfortunately incarcerated in that jail have also completed the survey. And then we're going to be traveling Monday and Tuesday to both the SVCC campuses of Alberta and Keysville, hoping to get SVCC's goal of 200. So if SVCC has its own young adult code, if that college collects over 200 responses, I think currently they're at about 30, they're going to get their data cleaned and sent to them courtesy of the state of Virginia. So great work. If there's any location that you're connected to where 18 to 25-year-olds gather, please drop it in the chat box or email me, text me, send me a message. My team will check. They're still going to be rolling in the coming days, all the way to April 30th, to visit any local establishment or any local area where 18 to 25-year-olds may be gathering. And I'll say that they have done a phenomenal job to connect to these young folks. Any questions about that? All right, and then if not, Jenna, you want to give some updates on our two youth coalition? I can't say that enough. I'm so excited about our youth coalition work. It's so fantastic.
Yeah, so I had both my meetings this week. Tuesday was Mecklenburg, Wednesday was Halifax. Mecklenburg had their second meeting this week. They're going to be doing a survey collecting information on vaping, tobacco, alcohol, and marijuana. We're working on that. And they're going to do a tabling kind of right after prom to get some ideas from what people did during that prom time. And then we're going to meet over the summer and kind of figure out what it is we want to focus on for the next year. For Halifax, Halifax is doing a million things. If I miss anything, Kim, let me know. But they are doing a safe talk tomorrow. They're doing a safe talk in April. We are working on bringing a speaker, the Virginia teacher
of the year.
The Virginia teacher of the year is, we're planning on bringing to Halifax High School in the first week of April to do a presentation on marketing, predatory marketing for vaping, and then also some addiction information as well. They have done so many things. They're going to be helping out with the SMVF summit as well. They're going to help us set up and also be there. They're going to have a table there to do some of their stuff. We are working with the JROTC to also come to that as well. I did talk to them yesterday.
Nice.
Let's see, what am I missing? They're also doing a Revive training. A bunch of the kids want to be Revive trained. 2 Safe Talks, a Revive, a summit. They're coming to the SMVF. They also will be helping Danielle out at the Infant Maternal Health Summit. So they'll be there too. They'll have a table for there. So if you guys are there, please say hi to them. They're all very nice kids. What else?
We did poison control yesterday.
Oh, yes. You guys, they tabled for poison control because it was Poison Control Awareness Week this week. So they tabled in their cafeteria, I believe. So they've got that, and they're also going to be probably tabling in the upcoming month as well to talk about some of the vaping things and do some recruitment for our summer meetings that we're going to have. Yes.
And if sign the table, it's you speak or just speak?
It's just speak.
Okay.
Yep.
It's an acronym.
Yeah, it's an acronym for students
prevention, education,
for
awareness, and
prevention.
knowledge.
Yeah. Yeah. You can just do speak and capitalize it. It's fine. Yeah, they'll know. They'll know what to do. I think I
Kim
covered
said
everything.
something a second ago because it came up, that dynamic screen lit up.
She said the poison control thing.
Oh, that's
Yep.
right. So this is Poison Control Week. That's right. Shelley Clary gave us great information.
Yep.
Poison control information will be on social media, our website, all this week. Thanks to the kids also doing that outreach at their school. That's fantastic.
Yep. I'm trying to think. I don't think I missed anything.
All right. Anything else? Updates for the youth coalitions?
No, they're good.
Can I add here? I am still hoping that Brunswick will develop a youth coalition. So I started this asking about it last year. It's been a year. But this past month, I did go to the Board of Education meeting. So just to kind of scope it out. So I'm hoping with the updates from Mecklenburg and Halifax that I can actually present to the Board of Education and maybe start there this time, because I've gone to administration and nothing has happened, but I'd really like to present to the board and see can we get started there. And I am going to talk to a couple of them individually before the next board meeting. But I would appreciate any insight anyone else has. But I'm still pushing for it.
Thank you, Jeanette.
I wonder if some of the Speak kids or the Mecklenburg kids could attend that meeting or maybe pre-record a message for the board.
Yeah, yeah. And I'm thinking like, I wonder if it would be like, you know how you guys are putting that stuff on social media, like the Speak have their Facebook. I wonder if making some PowerPoint slides.
Yeah.
Okay, well, I can ask for a presentation, so I can try to get on the agenda then, so I'll have more than 3 minutes to speak. So I'll work on that from this end, and then I appreciate it. I'll make sure I look up the meeting date and go from there. Thank you.
Okay. Yeah, Jeanette, let us know the meeting date. We can send you some materials prior to, or if some kids can go, we can go.
Even if they can't go, because it is a bit of a drive.
Right, right.
I think the pre-recorded message would still be.
They have a great IT person, so if we have some shorts to be able to show, that'll be great too.
Okay, awesome.
Hey, Jenna, I don't know if this would help her any, but if we could get some recordings, I'll be happy to do it too, of like some of the kids who are very prominent, some of our leaders,
Okay.
like the value of it.
Okay. Awesome. Okay. Wonderful. All three. Sorry, it makes me giggle. I think it's fantastic. All right. Now on to the summit. So we did have our final planning meeting for the summit. Let's see if I can share from my files. Okay, where's my file? Maybe I won't share. So we have solidified our speaking roster for the summit. We are working on getting headshots and bios from folks. We are working on newspaper ads, radio ads. We have secured folks to have tables. Oh, sweet.
Last year has, and
Yeah.
seen working.
Hold on, let me do the S and VF, and then did you email that to me? Let's see, where is that? Let me get the S and VF flyer. So we're good to go. Registration, you said, Jenna, is like around 60. Hang on. Here we go. Hang on. We've got our panel, lived experience panel being developed. Let's see, where'd it go? Oh, there it is. There we go. Nope, where'd it go? No, there it goes. There we go. So we know again at this point, if you need any additional flyers, please share on social media. We've got lots of engagement for that. Our guest speaker is going to be Commissioner John Morris of the Veterans Administration, who has been commissioner now for a number of years. Keynote speaker is going to be Ben Shaw, and then followed by Allison, Natalie, Dawn Grissard from US Vets, Dom from Danville Pitt on problem gambling, and then Derek Hayes from
These are
Halifax County Sheriff's Officer as a veteran, and we'll be doing our lived experience panel. Elena is going to be one of our MCs of the event. So it's going to be like a regular, like day of the Oscars, going to be going from event to event, presentations, lunch, networking. There's going to be lock and talk training at this event. There's going to be revive training at this event. There's going to be stroke smart training at this event. Like, we're just going to keep people busy and rolling and feeding them from 8:30 to 3:30 on May 21st. If you haven't yet registered, please do so. This is turning into a wonderful, wonderful event. And again, like I said, registrations are increasing. The prize holds 200 people. We would love to have 200 local folks in the summit on May 21st. Please help us by spreading the word. Right. And then next item, Danielle, the infant maternal health collaboration.
Sorry, I had.
That's all right. That's all right. No.
Program.
Oh, sweet.
Fires.
Okay. And I've got a comment in the chat box. Oh, that's weird. That's to mute.
And posting that, I'll be sending the approval to you pretty quickly today, maybe. Hopefully we'll have some. Yeah. Anything else? Do you guys have any questions about it? I'm gonna send you an updated flyer for others. And then. Oh, for everybody, but yeah. What we found in the coalition of the, different, these flyers that are in the program.
Okay.
I can't hear.
No, did you email me any type of thing to share on the screen?
No.
Not yet. Okay, all right. So for updates for the Infant Maternal Health Summit, April 18th. So the flyer will be coming out shortly. That's going to share with folks in our local community that the Infant Maternal Health Summit will be April 18th at PAS in South Boston, followed by on June 6th at the Estes Center in Chase City, followed by August 1st at the Brunswick Conference Center. So we are just a few days away from getting all that together so that we can publicize it and begin getting folks registered for those 3 events. So be on the lookout on social media, through our newsletter, information about that. All right. And I think we've solidified that. The planning meetings are finished. We've sort of got all the partners ready. Again, very similar to the SMVF Summit. Lots of folks who have signed up to be resource tables, to share information, again, connected to infant and maternal health. Anything you all want to add?
To have a resource table that hasn't already set one up, just email me or.
Okay.
Kenan, and we can, or Jenna, and we
Okay.
can get you in there.
All right.
The panel of practitioners, midwives, nurses, if there's somebody that wants to be a part of that, you're welcome to at any time, any of the panels, any of the locations.
Okay. All right. Oh, can I get that email address? Yeah, I just dropped it in the chat. If you will email us, and I'll put it in there, easy, prevention@southsidebh.org. Jen and I both will get it, and we will connect you to Danielle to get a table. Absolutely. Absolutely. Is that okay, Danielle? Alty Street from Medicaid Dental? No. Me.
Altice Street, Great Dental Plan Stop.
Yep.
Yes, and I would
Okay.
love it, Altice, if you could be there. I was thinking that it would be perfect.
All right, awesome. Any other questions about the infant maternal health? Again, please mark your calendar. Oh, it just got a heart. I love that. And the cool stuff that Zoom does now. All right, and then update from the book club. Kim, how's the book club going?
So, it's going. I've had one person completely finish. She loved it. I've had another person, come to me and they're working on it. She was reading it yesterday during game duty, actually. But she said she is enjoying it as well. I've had a couple of extra people sign up for our ACEs training to go with it. So, I'm hoping we get some more traction, some more people involved after that. I'm also hoping for maybe a summer session when teachers are, laying by the pool and all that good stuff.
What is the book?
They're doing the Dr. Bruce Perry. Awesome. Great idea. Summer idea is a great idea.
Yeah, I feel like I'm hoping I'll get more buy-in for that. We'll see. But that's about it.
Okay, thank you. Thank you for the update. The leadership update, the floor is open for leadership team updates. Oops. Okay, hang on, I'm gonna access.
Kenan, there are some flyers I could forward out with some training dates from BDH that are upcoming. So there are a lot of different dates. Can I just forward them that they can go out?
Absolutely, absolutely.
All right.
And I'm bringing up the volunteers flyer. Come on, there we go. Here we go. Brenda, did you want to talk about this?
So if you were on our meeting in December, John, we went over the different healthcare assessment results and data. And so part of the next step for that process, probably the CHIP process, that CHIP's the community health assessment, the CHIP is our community health improvement plan. And that part of it is really community-led, community-driven. So I'm looking for volunteers who'd be willing to help kind of sit on a committee and look at the top prioritized needs, which I put on there for access to healthcare, aging, and other care and chronic disease. Those needs came from you all ranking them after the presentation. So really what we're going to do is have groups, you can help us decide what the goals are to help meet those needs, what the steps are to meet those needs. I'm going to try and not make it too much, but we're going to have some meetings, and once the committee comes together, you all can kind of decide how often you want to meet and things like that.
All right, awesome opportunity to work with the health department. Fantastic. Fantastic. Any questions about that update? All right, floor is open.
I have a few other things if you have time.
Oh, absolutely, absolutely.
I have several things. We already talked about CHIP. Just a reminder, we still have stroke smart materials. I have small posters, business card size information, and I also have yard signs which have the signs and symptoms of stroke. So if anyone wants any of the above for your organization, let me know. They are free. It's an ongoing project just to help raise awareness. And Amanda Hutchins, our MRC coordinator, does do a stroke smart training. My team is getting trained on that shortly as well. So it's something else we'll be able to offer. In addition to that, Jeanette mentioned we have some trainings coming up. That is part of our outreach for Public Health Month, which you didn't know is in April. Public Health Week is that second week of April. So during that week, that Thursday, which is April 9th, we'll be doing an open house at all of our locations from 4 to 6 o'clock. And so basically you can come in, you can meet all the different public health staff, programs that we have, everything that we can offer, and just kind of get to know what we do. And so then when we put in our Facebook, I have flyers for that as well. And then to go with that, we do have trainings throughout the entire month, both virtually and in person, including Stroke Smart, Revive, Stop the Bleed, all the different things that Amanda does. So really just trying to get a lot of public health education and stuff going out there for the public health month.
Awesome. And you guys are going to send those flyers. I don't think I've received those yet,
Yeah,
right?
just came out.
Okay. Okay, that'd be great. That way we can put them on social media. They can go in our next, I'd say our coalition newsletter just went out this week, but our agency newsletter goes out a few weeks prior to that. So that'll be coming out early April. So if you can get those to me before the end of the month, between you and Jeanette getting these to me for the end of the month, I can get Sarah to put them into the Southside Behavioral Health newsletter, which comes out that first week of April. All right, awesome. Oh, awesome. And Altice put some stuff in the chat box as well. Thank you. Community partners page, monthly information session, lunch and learn. Well, awesome. Thank you so much. You said stop the bleed. I'm just putting it in the chat box just so people know. All right. And then
the flyer we have a lot of information.
okay. And I know that some of our team here at Southside Behavioral Health that are Revive trained are going to be helping you all.
Yep.
So it's an awesome collaboration. Awesome.
Also be doing the rapid revive most of the locations except for Chatham. We'll also be doing free blood pressure checks at all of our locations except Boynton, which that's one of our clinical sites, environmental health and our team and Amanda. So those will be offered there.
Okay, so you're gonna have Public Health Month activities all across, not just April 9th.
Yeah.
Okay, I put that wrong in the chat. Public health activities all month, and you're gonna send flyers. Everyone's gonna send me flyers. Okay, great. I'll be on the lookout from both of y'all. Flyers for April. Okay. And as soon as we get those, we can put them out to social media. Okay. Okay, other announcements. Other announcements.
So I don't really have any update about the COC. The COC is the continuum of care. It's our regional response to homelessness in the community. The last time that I updated y'all, I let you know that all of Tri-County's programs are currently at capacity, which is a polite way of saying we have no money. That hasn't changed. So if anyone calls requesting assistance for homelessness, there is nothing we can do except refer them to shelters, which we don't have any.
Oh, wow.
Not good news, but that's the news.
Okay. Thank you. Thank you for the update. Let's see. Also want to share. Where did everybody go? There we are. What did I do? I don't even know what I did. Hold on, let me go back. There we go. Also want to share. So we are hosting mental health first aid and the SVCC Alberta campus 2 weeks from tomorrow on April the 3rd. There it is. It's Southside Virginia Community College. There are spaces available in that class right now. It's going to run from 9 to 4:30. The college is providing lunch, so you can join us. I'll be one of the trainers doing adult mental health first aid at SVCC starting at 9 and at 4:30 at the campus in Alberta. Absolutely. Okay. Hard copies, and then I can send you the digital. Yep. And then Jenna will send out the digital with the follow-up as well. And then we're also, look at this, y'all. Hope everybody can see this, right? Please tell me you can see this. You can't see this. So VCU Hospital, look at this, has agreed. Catherine on my team worked with the hospital. These are the classes we'll be providing in mental health first aid at the hospital, at the care building, between April all the way to October. Obviously, the dates are connected to when the hospital was open and when our calendar was open. So no rhyme and reason other than trying to make sure we're coordinating dates that is open to trainers to be available and the hospital is available. But getting them out in the community early enough that we already have folks, there's a registration link. Folks can already go ahead and register for October 16th, get on the roster. Once the class is loaded to 10 folks, that is when we launch the pre-coursework. So this does give folks the opportunity to make time for that. Also, only you know, we're working with Halifax Hospital as well. Haven't solidified dates yet, but again, trying to pinpoint some different days within the coming months, all the way to December, because we did stop VCU in October, putting in some more dates where folks in the Halifax, Mecklenburg. So it's this sort of a Mecklenburg Brunswick initiative, Halifax to do, again, youth mental health first aid and adult mental health first aid. So be on the lookout. Please share these with folks in the coming weeks and months.
Are there
But
any plans to do another one for older adults?
I can. If you can help me with like a target population, that would be great. I can do that. Yep. The person who co-trains older adult population went out for knee surgery. It must be catching around here or something. I don't know. You shouldn't joke about that, but since I had knee surgery, I feel like I can joke about it. Went out for knee surgery, and when she comes back, probably mid-May, I'll get with her and we'll get you a date. She's real easy to work with. All right. Let's see. Oh, awesome. Yes, Danielle has another.
So if you have a client that you'd like to get more support through pregnancy and postpartum, I've got one referral form you can share and I'll email you those. Good.
Okay, referral form for infant maternal care. All right. If you want to give one to
Gave to
Jenna, she can scan it and send it out. Okay. To everybody on the call. Okay. All right. Other announcements? Okay.
What is that I'm doing? April 18th.
Oh, April 18th.
Okay. The Healthy Kids Day for the YMCA. Yeah.
So on April 18th, there's the Infant Maternal Health Summit at PAS in South Boston, but also at the same time, the Clarksville YMCA is hosting a Healthy Kids Day at their Chase City location. Right, right. So we're trying, it's getting to be a busy season. This is nice.
We moved it. Oh, now we'll be 11. Never mind. It's also prom for me.
Okay.
Yeah, yeah.
Yeah, it's a lot. It's a lot going on.
Yes, lots and lots. Lots of great stuff.
You guys, Tri-County Domestic Violence Program is doing an ATV ride on April 11th. I forget the location, but we do
Okay.
have the flyers. And it is, I think, $20 to ride, $5 or to drive your ATV, $5 if you want to ride along with someone else, and $10 just to show up. There will be food. This is a fundraiser for our people.
Fundraiser. If you can send me the flyer, we can get it out there. All right, awesome.
11. Thank you.
Okay. All right, other announcements. We have all kinds of wonderful stuff going on in the communities in the coming days and weeks. We're all overlapping each other, which happens in a rural area. I mean, that's the nature, but we're all doing great work. I'll keep being super busy. Anyone else for announcements, comments, questions? We want to be respectful of your time. We are looking at 11:14. Again, can't strongly encourage enough to look at your social media, check your emails for newsletters. Yes.
Doing free blood pressure checks, screenings at the YMCA from like 11 to 1 or 2 today.
Oh, wow. Okay. Awesome. At the South Boston YMCA? Oh, geez, our neighbor. We
So that there's no visit there. And also 2:00 at Boynton. Amanda is doing a stroke smart.
Yes, that's today. Now we've had that on social media and it was in our newsletter. Yes, folks are heading to the Stroke Smart today with Amanda Hutchins. Yes, I know we had that flyer that's been promoted. Hopefully lots of folks are going to that today. All right. All right. Any other announcements online? Questions, concerns? All right. Well, thank you all for joining us today. We'll follow back up with you with the wrap back around with an email to you with the minutes, the agenda, flyers. If you are going to send me flyers, please send them, email them. You all have a wonderful day. Thank you so much for joining us.
Thank you. Good day.
Okay, are you sure? Yes. Okay. You sure?